an exciting program for us. It's a combination of students from Harvard Dental and from the University of Costa Rica, from the School of Dentistry. Now, they are here for a 1-week extension course, building on a program that they have been taking.
Part of a project that we're calling the Global Health Learning Helix, which basically you imagine 2 threads of learning, one that takes place in a classroom and one that takes place in the world. The backbone of the Helix are competencies or objectives that we are striving to meet both through classroom learning and field-based learning. Professional collaboration is one of those backbones. Team-based learning and problem solving is another backbone. Focus on prevention and health promotion is one of the other backbones. We're evaluating and piloting a lot of this as a team with CISG to see how this model works, where we are learning together in a classroom setting in a totally different region of the world, but tackling common challenges and then bringing our learning to a new setting and seeing where the synergies are possible.
So let's say today we were visiting the Canzona Indigenous Territory, where we've worked closely with both traditional birth attendants and traditional healers in order to provide better channels of communication between the traditional health system and the Western health system. So that's just one example of what the students do and how they combine the in-class learning with the experiential learning.
I gain an appreciation for the importance of forming connections with communities and building these relationships that can have health impacts that are far superior to just going into a community and providing care, whether it's dentistry, medicine, surgery. Forming a sustainable relationship with community where you can facilitate autonomy is really something that I took away from this course.
One of our core values is really whole patient health and seeing the mouth as part of the body. So our students learn from the moment they begin that the mouth belongs in the body. I think Costa Rica is a really exciting example of that in practice, where patients are seen and treated holistically, and oral health is included from the primary care level all the way into their hospital care.
I had never learned about Costa Rica's healthcare system. I had heard from looking into this course that it was very well planned and developed, but other than that, didn't know anything about it. And I think seeing how their approach to a smaller country has been seemingly very successful, and how much trust and value people in this country actually place in their healthcare system and their government, I think that surprised me coming from the US, where I've lived my entire life, and most people will question me constantly as a healthcare provider one day, and I think it was both encouraging and truly surprising.
The potential takeaways from this week for our students at HSDM, I think, are numerous. It depends, I think, where they are in their thinking around their role as a dentist in today's world, but my hope is that they really think about how to optimize the skills and knowledge they're gaining at HSDM in ways they maybe haven't even considered. Or if they have considered, that's really begin to clarify the direction they may want to go with their careers in the short term, in the long term, so that they can really feel like they're contributing and meeting their full potential as dentists.
I really learned how collaborative global health is. Global health is not done in a vacuum. It's not one person that can improve global health and work on global health alone. It's all collaborative, and connecting with the University of Costa Rica dental students, that we both learn so much from each other, and we'll be future colleagues in global health as well. That's the biggest takeaway I've had about global health through this course.
I didn't realize how immersive the experience would be, between living in this jungle environment for a week to entering indigenous communities and interacting with the community leaders and going into someone's home and seeing what their life was like, to visiting an African palm oil plantation, to talking with somebody in the Ministry of Health. There were just so many factors that I didn't realize would enrich the experience. That I'm just incredibly appreciative of this experience. It's definitely far exceeded my expectations. I've learned so much. I've made so many awesome connections with people.
This week just really bolstered my toolbox of questions to ask or perspectives to think about, so that wherever and whatever I end up doing, I think it gave me a greater sense of humility as well as tools to use down the road to hopefully make an impact wherever I am.